Most people think stomach cancer starts with obvious pain or vomiting, but the truth is it rarely does. In fact, early warning signs are so subtle that they are often mistaken for simple indigestion, heartburn, or even stress. But here's the scary part. By the time classic symptoms appear, the cancer may already have spread. So today, we break it down 5 strange overlooked signs of stomach cancer, the kind your body might be whispering, not shouting, before it's too late. Stomach cancer, also known as gastric cancer, begins in the inner lining of your stomach, usually in the cells that produce mucus. It develops slowly, sometimes over years, starting from chronic inflammation known as gastritis, often triggered by Helicobacter pylori infection, poor diet, smoking, or excessive alcohol. Globally, it's one of the top 5 deadliest cancers, yet its early signs are deceptively mild. Your digestive symptoms gives subtle clues long before tumors grow large. Problem is, most people ignore them or blame them on common digestive issues. Let's dive into 5 worried warning signs that could point to something more serious. If you feel full after just a few bites, even when you haven't eaten much, don't brush it off. This early satiety happens when a tumor begins to form in the upper part of your stomach, pressing on its walls and limiting how much it can expand. It may start subtly. Maybe you can't finish your normal plate anymore, but over time it becomes consistent. Researchers at the Mayo Clinic found that early satiety is among the first red flags in patients later diagnosed with gastric cancer. It's often mistaken for slow metabolism or bloating, but when persistent, it deserves medical attention. Here's a strange connection: your stomach and your energy levels. As cancer develops, it can slowly cause microscopic bleeding into the stomach, leading to iron deficiency anemia. You might not see visible blood in your stool, but your red blood cells drop over time, causing tiredness, pale skin, dizziness, or shortness of breath. A study published in Cancer Epidemiology found that over 40% of your stomach cancer patients reported persistent fatigue as one of the earliest symptoms, long before diagnosis. So, if you feel constantly drained despite sleeping well or eating normally, it's worth checking your iron and hemoglobin levels. This is one of the strangest but most consistent warning signs seen in early gastric cancer. Many patients report sudden disgust or loss of appetite for meat, especially red meat. The reason: stomach cancer cells release inflammatory molecules that interfere with the digestive hormones and the taste receptors, particularly those linked to protein digestion. Doctors have observed these symptoms so frequently that it's sometimes called the meat aversion signs. If you notice that the smell of or taste of cooked meat suddenly makes you nauseous, and this persists for weeks, don't ignore it. Everyone experiences indigestion occasionally, but when it becomes persistent and unresponsive to antacids, it could be more than reflux. As the stomach cancer grows, it affects acid secretion and motility, leading to chronic heartburn, burping, or burning discomfort behind the breastbone. A 2021 meta-analysis in the gastroenterology showed that patients with a new-onset, long-lasting dyspepsia and digestion after age 40 has significantly higher risk of a gastric cancer, especially if some symptoms worsen over time. If your heartburn pattern suddenly changes, it's stronger, longer, or resistant to medication, see a doctor for upper endoscopy. If your stomach feels bloated even after light meals and you're losing weight without trying it, it's the major warning signs. Tumors in the stomach can interfere with the normal digestion and nutrient absorption, leading to muscle loss, bloating, and malnutrition. This symptom often appears late but can start subtly, as a sense of heaviness or fullness after eating. A Lancet Oncology review found that unintentional weight loss is one of the most consistent predictors of a hidden gastrointestinal malignancy. When bloating, early satiety, and weight loss appear together, it's time for gastroscopy, a simple test that can literally save your life. If you notice even one of these symptoms lingering for weeks, don't panic, but don't ignore it. Most of the time, it's something minor, but sometimes your body whispering before it screams. Early detection is everything, because when caught in its early stages, stomach cancer is up to 90% curable. So, listen to your body, get checked, and share this video to help others catch the signs early too. Hit a like if you found this eye-opening and subscribe for more life-saving health breakdowns backed by real science. Taste and trait H. pylori. Chronic infection is the number one cause of a gastric cancer worldwide. It more cruciferous vegetables like broccoli, kale, and cabbage. They contain sulforaphane, a compound that kills H. pylori and protect your stomach lining. Limit smoked and processed meats, which contain nitrites linked to gastric tumors. And stay hydrated and manage stress, since chronic inflammation worsens digestive cell damage. Stomach cancer doesn't always roar, it whispers. Strange fullness, fatigue, food aversions, or persistent heartburn might not seem serious, but they can reveal what brewing deep inside. By understanding these 5 early signs, you give yourselves and your loved ones the best chance at early detection and a long-term survival. Your health isn't just luck, it's awareness, consistency, and action.